physiotherapy for the last 3 years, correct? Yes. Okay, he's been having physiotherapy for the last 3 years. He's in a very similar situation to the younger child who is 3 years old. He's now 6 years old. Okay. Our objective here, okay, as you see, we have a difficulty in the coordination of the walking, okay? So we have central nervous system damage, but in any case, we are going to be applying the tape. You feel here, you see the knee, which is swollen. You feel the muscle fiber, which is very hypotonic or very stiff, okay, and rigid on the leg, and the adductor muscle is extremely rigid, okay? So, you see in this position he is not able to relax, okay? So in a sitting position like that, okay? Takes him some time for him to flex his knee, okay? He's had some infections.
It's a long way, no? Maybe it's long process.
Okay. Okay, so you...
This. Mickey?
Eh? Mickey?
Yes, Mickey. See this one.
So stretch the skin down. Okay, so you see here, stretch the skin down. And to apply the tape,
you apply this.
Can we flex a little bit more? Is that possible?
Yeah, sure. I'm here.
Just hold this short.
Okay. Take it.
Okay.
Mickey.
Stretch the skin down and to apply the tape.
Oh. Wow, very good.
Has to flex a little bit more if possible.
Fare d'arcola.
Very strong.
Relax. Johncina, relax.
Stretch, no tension. So over the muscle fiber, which is in retraction, okay? So just like that. So, okay.
Down. Yeah, very good.
Down.
More down. Fully.
Okay. Okay, so you see here, the tendon is extremely rigid, okay? And the muscle fiber is very hard, okay? So you see here, the difficulty in the mobility of the ankle, foot, and the metacarpal. Okay. So it's very difficult, very rigid. So rigidity improves mobility or limits mobility? Limits. So here we need to improve the mobility of the ankle and of the foot. So here we're going to apply tape. We're going to cover the heel. We're going to take the measurement up until the popliteal fossa, which is posterior knee. And so this is the length of the tape. Just like that. Okay? Apply the tape, no tension.
No tension.
Up until that point.
I'm here.
Okay.
Sami.
And now we're going to put the foot into maximum dorsal flexion. So, so you need to stretch the skin up. So we're going to put into maximum dorsal flexion. Just have to wait, breathe, and wait. Okay? He's trying to fight against it. He goes into muscle contraction. You just have to wait until you get to the maximum range. Okay? Alex is stretching the skin up, stretch the skin up, and to apply the tape, no tension. Just like that. Okay, just like that. Okay? And then we're going to go onto the muscle fiber. This is a tendon, eccentric. Now we're going to go into the muscle fiber. So just stretch the muscle, stretch the skin, keep the foot into dorsal flexion and to apply. And to apply. Okay? Okay. So as when he comes back into this position, you see how the tape is wrinkling, okay? And wrinkling over the muscle fiber. We're going to activate in this way. Okay? Straight away it releases. Releases very quickly. Okay, just like that. Okay. Okay. Okay, centering the Achilles tendon. Slight ligament coriace. Okay.
One here.
Stretching the skin up and to apply the tape in the middle of the muscle fiber.
Where? Here? Here. Tell me.
Just like that. Okay, make sure it's well stuck before you.
Make it so. Come on, so everybody. Yes. Wow, very good.
Okay, so to improve the mobility of the foot and ankle, we are now going to apply tape over the anterior tibia, which means we're going to take the measurement with the foot into plantar flexion, eccentric. So here, we're going to apply it in 3 different directions. So the first one, with the foot in maximum plantar flexion, stretching the skin up, and to apply the tape directly towards the large toe.
Yes.
Oh, thank you.
Directly towards the large toe. Okay, the second is going to go towards the second and third toe, which means the foot into plantar flexion, slight inversion. Okay, just like that.
No. Put it here. Okay, I'll open it.
You see? Okay,
Put it here.
Okay. Make sure the tape is separate one from another. Okay, just like that. And then go down. Okay. Now the next one.
Put it here. Here.
Okay.
Here.
Now we're going to put the foot into plantar flexion in inversion again, stretching the skin up. Just tap there. Tap on top. Mettete dorso. Bravissimo. Così. E vai giù. Okay. All the tape is anterior to the external malleolus. Just like that. Okay. So as when the foot comes up, okay, you see how the tape is wrinkling. The wrinkles means that the tape is going to push down. Okay, which means that rigidity is going to be softened. And you see already like this. Okay. You're going to activate in this way. So to improve his walking pattern, we don't need compression. We don't need restrictive bandaging. We need his muscle fiber to work better. And so the muscle fiber to work better means that it has more blood circulation, more drainage, and it has more capacity to be elastic. And so we're going to apply it also on the other side.
Yeah.
So the first one, just in plantar flexion, and you're going to go straight down on top of the great toe, just like that. Okay, covering the muscle fiber, which is lateral to the tibia. second one, plantar flexion in inversion. Yeah. I see.
Das. Nanti. Jangan sih. Relax.
E l'ultimo, ancora più in inversione, sempre anteriore al malleolus. Significa, it means that you're on top of the tibial muscle group.
Strong.
Okay, so just like that. Okay.
Jangan. Stay. Nothing there.
Have to apply it in decompression, which means in a lying position with the hands over the head. Change. Braccio sopra la testa.
Sbaccia. Mikey.
Stretch the skin down and no tension. Stretching the skin down so as you're on top of the rib cage. You see that? And then let go. Okay, so they have to be symmetrical, lateral to the umbilicus and to the medial line. So stretch the skin down. Okay, so this application here is very important in pediatrics. Abdominal plus lumbar, because this is going to help the coordination of the abdominal and lumbar area, which is going to improve any sort of walking and posture. Okay, just like that. So it's when the arms come down, you see how the tape is working like that and working in this direction. Okay? Hook.
Johnsina, very muscle.
Kafel. Kunci kafel.
Okay. And then
Mikey.
Look me. Look at him. Look at me. Okay. Head. No. Head down. Look down. Listen back. Look at me. Ready. See? Jana. It's okay. Done. Finished.
okay, back. So just stretch. No, more flex.
No.
Mm-hmm. Yeah, just like that. Okay, perfect. Okay, so
Very good. Back.
excellent.
Hindi ka na hanti ako back. Share. Right. Look down. No. Hand. Look down.
On the anterior tibia, application posterior to the Achilles tendon and gastrocnemius. We can also apply the tape on the knee, which we'll do perhaps day after tomorrow. Okay, so we'll see the patient maybe on Wednesday. Okay, so the application on the knee. Okay, because you feel here the knee joint is very compressed. Okay, also the adductor muscle, flexor muscle. But the abdominal and lumbar application is going to improve the coordination of the posture and also the neck. Okay, so let's get the patient dressed and then